Hello, intro to stats class. Today we are going to learn about refusals, non-adherers and dropouts from the book Statistics Through Application by Yates, Starnes and Moon. Alright. So we already learned about experimental design in our previous videos, and here the most important trouble, the most serious trouble is about refusals, non-adherers and dropouts. So let's talk about these three things separately. Refusal, basically when sometimes the participants, they refuse to give their input, and it's really very serious issue. And if they refuse, then in that case only the input from those people goes into the output when they cooperate. It doesn't come from the people who are not cooperating, or so it is sometimes it can be underrepresentation of certain parts of the population which are not presented properly, or it could be a minority group. So it causes not a fair representation of the population. All right. After this, we have another important thing is non-adherers. For non-adherers, here these are specifically those kind of people who participate but don't follow the experimental treatment. They say, okay, I'm going to be there, but suppose if they're asked to follow a certain kind of medication and they don't follow that, they just change. Like for example, AIDS patients who participate in trials of new drug sometimes take other treatment on their own, or they feel that they should be doing something else or taking some other kind of medicine so that they can get better, instead of exactly following the protocol, whatever being told them in an clinical trial. Or there could be another case of dropouts. Subjects who begin to experiment, they begin but they do not complete. There could be two reasons. They do not complete because of some unrelated causes to the experimental treatment. Maybe they're not available, or some kind of trouble. They're not ready for that, or some kind of change in their life. But if it is because of experimental treatments where they are having harm and that's why they leave it, then that's a serious issue in that case. Like dropouts can be bad in that situation. So that is something one should keep in mind. What is the reason for dropouts? So just number of subjects is reduced if it is because of non-experimental related problems. And then if subjects drop out because of their reaction to one of the treatments, bias can result. All right. So let's move to next things, dropouts in medical study. Why do we see the dropouts there? There are few things. There could be that people, they don't want to be part of clinical trials, and then in that case the retention and compliance, that is really hard. All right, they don't retain, they don't follow whatever being told to them, and so in that case we can see that there could be several reasons for that. The first reason could be inconvenience to the patient. It's not convenient for them. Could be it requires overwhelming visits, or it could be the time where they have a time conflict whenever they have to, maybe they're going to school, they have a work hour, or a lot of other things that can force them to leave it. Then forgotten appointments. Sometimes some patient, they commit some kind of towards some kind of experimental design, but they keep on forgetting, or maybe they're busy with so many things. So missed visits or missed participation can sometimes impact the study result. Then the third kind of thing is unclear expectation. Maybe the patient is thinking that may know a lot about his or her condition, but protocol language can be confusing. It means they are not informed properly about the study participant. The most study participant, they don't know. So patient may be unsure about this, that what is their proper role, what they're supposed to do, and how it's going to be affecting the result. Next thing is lack of appreciation and trust. So lack of appreciation and trust, basically sometimes people feel like that they are just a number, they're not something important for this. If they just drop out, it's not going to make that much difference. And sometimes they have lack of trust in the medical establishment. They feel like it's not done, it's not authentic, or not going to be helpful, so they just drop out. Or could be a condition where condition stagnancy, like if it is a clinical trial, a medical trial, so experience, if it is positive for them, for patients, so they may likely to retain there. Okay, but if it is not positive, they're finding very harmful impact of the treatment, then they may not retain, because it's for their safety. And if the symptoms or side effects actually become worse, they drop out from there. So that these are the different reasons, and I'll be starting next chapter 3.2. Till then, if you like the video, like, share and subscribe. Stay healthy. Thank you so much.